Ever wondered how healthcare services are planned? Why is it so crucial in the health sector? Well, let's dive right into it. Healthcare services planning is a fundamental step in the establishment of any health facility. It's the backbone of a comprehensive and effective healthcare system. But what does it entail? It includes medical services, clinical services, surgical services, laboratory services, diagnostic services, nutrition services, and a whole lot more. Now you might be asking yourself, how do we know what services are needed? The answer lies in thorough market surveys and needs assessments. These evaluations provide a clear picture of the health needs in a specific region or province. For instance, they might suggest the need for a secondary or territory referral hospital with super specialty services. Let's take a hypothetical scenario. We are tasked with developing a new health facility at a secondary level, covering a region or province. Our assessments indicate a high prevalence of cardiac disorders, heart failure, abnormal heartbeats, heart attacks due to artery blockage, and irregular heartbeats. These are all conditions that require immediate action, often within the golden hour. So, we decide to include a cardiac care service in our plan. This service covers specialist services, general services, audit services, and pediatrics, with both interventional and non-interventional treatments. Examples include pediatric echocardiogram-based surgery, catheter interventions, neonatal cardiac surgery, complex cardiac defect correction, and minimally invasive cardiac surgery in children, among others. For adults, we might offer coronary artery bypass grafting, mitral and aortic valve replacement, double valve replacement, and atrial septal defect closure in adult cardiac surgery. The objective is to identify as many services as possible to establish a detailed services list. This list is the master key from which we derive other needs such as human resources, infrastructure, physical services, equipment, patient needs, supplies, consumables, and even training and research and development. So, planning healthcare services is no small task. It's a significant step in ensuring the health and well-being of a community. Let's delve into an example, the planning of a cardiac care service. Picture an orchestration of services, all aimed at one goal, ensuring the best cardiac care possible. This service can be compartmentalized into specialist services, general services, and adult services. Specialist services are where the magic happens, with experienced professionals diagnosing and treating complex cardiac conditions. This includes a wide array of treatments from pediatric echocardiogram-based surgeries to neonatal cardiac surgeries. Each procedure is a symphony of skill and precision, aimed at rectifying issues that range from complex cardiac defects to abnormal heart rhythms. The general services form the backbone of the cardiac care service. These are the routine checkups, the consultations, and the follow-ups. They ensure that the patient's heart health is consistently monitored and managed. Then the adult services, the unsung heroes of this service. Through checks, we ensure that the highest standards of care are maintained for our adult patients. This includes everything from hygiene practices to the accuracy of diagnoses, and delving deeper into the treatments, we have pediatric echocardiogram-based surgery, a minimally invasive procedure aimed at diagnosing heart diseases in children. Catheter interventions, another minimally invasive procedure, are used to treat heart diseases or to assess how well the heart is functioning. Neonatal cardiac surgery, on the other hand, is a complex procedure that treats heart disorders in newborns. This can involve the correction of complex cardiac defects, valve repairs, or procedures like the Nikaido or the Ross procedure. For adults, we have a range of treatments like coronary artery bypass grafting, mitral and aortic valve replacements, and more specialized procedures like the arterial switch in newborns. Each of these procedures is a testament to the advancements in cardiac care and the dedication of healthcare professionals. This gives us a glimpse into the intricate planning that goes into just one aspect of healthcare services. It's a complex puzzle, but when all the pieces fit together, it results in a service that can save lives and improve the quality of life for countless individuals. Now, how do we bring all this information together? Enter the medical services list. This is the roadmap, the blueprint, the playbook that helps us shape healthcare services with precision and purpose. It's not just a list, it's a comprehensive plan that covers every aspect of healthcare service provision. The medical services list is a master key that unlocks the door to effective healthcare services planning. It is the foundation upon which we build our healthcare facility. It's like a jigsaw puzzle, each piece representing a specific service, and when put together, it forms a complete picture of the healthcare services that we intend to provide. Think of it as a well-organized roster that helps us derive our human resource needs. It tells us the number of doctors, nurses, and other medical professionals we'll need. It outlines the specialties we'll require. It gives a clear picture of the infrastructural needs, the size of the hospital, the number of beds, the operating rooms, and so forth. The medical services list also helps us define the criteria of operations. It guides us in setting the standards for patient care and clinical practices. It also helps in determining the physical services we'll offer. From diagnostic services to surgical procedures, from pediatric care to adult care, it covers everything. But that's not all. The medical services list also takes into account the equipment we'll need. From MRI machines to defibrillators, from surgical tools to lab equipment, it provides a detailed inventory. It also helps us understand patient needs and how to align our services to meet those needs. Furthermore, the list helps us plan for supplies, consumables, and trainings, and also gives an idea about the scope for research and development. It aids in planning for record maintenance and other allied activities. It helps us lay down the standard operating procedures and workflows. In essence, the medical services list is a comprehensive guide that helps us plan, execute, and manage healthcare services effectively. It is an indispensable tool in the hands of healthcare professionals, helping them deliver the best possible patient care. The medical services list is a crucial document in shaping the healthcare services that a facility can provide. It is the cornerstone of healthcare services planning, the first step towards building a healthcare facility that serves the needs of the community effectively and efficiently. But there's another factor that plays a vital role in healthcare services planning: healthcare facility design. You see, the design of a healthcare facility isn't just about aesthetics or architectural flair. It's a strategic tool that, when used correctly, can significantly enhance the delivery of healthcare services and the overall patient experience. Picture this. You walk into a hospital that's intuitively designed. There's clear signage, easy-to-navigate corridors, and a well-planned flow that guides you effortlessly from one point to another. This seamless navigation isn't just a convenience. It reduces stress for patients and their families, and allows healthcare professionals to provide services more efficiently. But how does the facility design depend on its services? Well, the range and complexity of services offered by a healthcare facility directly influence its design. For instance, a facility offering cardiac care services would require specific design elements, such as specialized operating rooms, cath labs, and recovery areas. These spaces need to be designed not only for functionality, but also for the comfort and safety of patients and the efficiency of the healthcare team. The design also extends to less obvious areas. Think about the waiting rooms. They should be comfortable and calming, reducing anxiety while patients wait for their appointments or treatments. Even the lighting and color schemes can have an impact on patients' mood and perception of care quality. Moreover, the design should be flexible and adaptable, anticipating future changes in healthcare services. As medical technology advances and healthcare needs evolve, the facility should be capable of accommodating these changes without major disruptions. And let's not forget about accessibility. A well-designed healthcare facility ensures that services are accessible to all, including those with disabilities. This includes not only physical accessibility, but also cultural sensitivity and respect for privacy. In essence, the design of a healthcare facility is a reflection of its commitment to patient-centered care. The design is not just about the physical space, it's about creating an environment that supports the healing process, promotes efficiency, and enhances the overall patient experience. So, healthcare services planning is not just about what services to provide, but also about creating a space where these services can be effectively delivered. So, what have we learned about healthcare services planning? Well, we've delved into the intricate world of healthcare services planning and understood its importance. It's not just about providing care, but about strategizing and planning, based on comprehensive market surveys and needs assessments. This critical step helps us determine the type of healthcare facility required and the specific services it should offer. We used the example of developing a new secondary-level health facility, providing a multitude of services. A key focus was cardiac care services, a complex field that requires urgent and specialized care. We discussed heart failure, abnormal heartbeats, heart attacks due to artery blockage, and irregular heartbeats that demand immediate action within the golden hour. Under cardiac care, we also outlined the vast array of services, from pediatric echocardiogram-based surgery to adult cardiac surgery. We learned that the objective is to identify as many services as possible to establish a detailed services list. This medical services list is the master key that unlocks the door to understanding human resource needs, infrastructural needs, criteria of operations, physical services, equipment, patient needs, and much more. The medical services list also plays a pivotal role in shaping the healthcare facility design. It's not just about building a structure, but creating a space that caters to the specific services and needs of the patients. This crucial document needs to be prepared first. It sets the foundation for the healthcare facility and influences everything from the standard operating procedures to workflows. In essence, healthcare services planning is like a jigsaw puzzle. Each piece, be it the market survey, needs assessment, medical services list, or healthcare facility design, plays a critical role. When these pieces come together, they form a complete picture, providing effective and efficient healthcare services to those in need. Healthcare services planning is a complex but crucial process that plays a significant role in delivering effective healthcare. It's a fascinating journey, isn't it?
The mission of Velocity Project Management Limited is to be knowledge partners by providing project management consulting services along with training services. Our vision is to be the leading institution for project management and management consulting services in East and Central Africa within healthcare. 1. Business planning. In planning, we start from the conception/idea of opening a health facility for our client by advising to do the right sizing of the facility, placement of the facility, and business guidance is provided too. 2. Infrastructure development involves engineering services, procurement management, tender management, project management, guidance on negotiation. 3. Equipment design and supply. Medical and non-medical equipment and maintenance are equally important to run a hospital, which needs planning from the beginning of conception. Proper contract management with all suppliers for spares and training of all HR involved. 4. Operations, management, training. Running of the hospital and handholding is taken care of by providing the right HR, business process mapping, HIMS, standard operating procedures, and defining various policies.